September is Prostate Cancer Awareness Month, a time to raise awareness about the second most common cancer in men. I am joined by Professor Shingai Mutambirwa, who is the head of the Department of Urology at the Sefako Mahato Health Services University. Prof, good to have you on the program this afternoon. Now, September is Prostate Cancer Awareness Month. Can you explain why early detection of prostate cancer is so crucial and how it impacts the odds of survival?
Thanks very much for the opportunity. I think the important thing to remember is that, guys, we have something called the prostate, which sits just below the bladder, all the way around the pipe for passing urine, which is also your pipe for ejaculation. And its job really is to produce most of what a guy ejaculates, because less than 1% of what a man ejaculates is sperm. It's mainly stuff made by this prostate and another gland called the seminal vesicle, things like sugars and proteins and things. And like you said, Nhlantla, the leading cancer in the world is skin cancer, but we don't get that. It's not really fatal. But prostate cancer is the second most common cancer. And if we pick it up early, which usually means that we start doing a screening test from about the age of 40, which is really just a blood test, guys. We don't need to, it's no longer in the guidelines that you need to have a rectal examination. It's just a blood test, which is taken about once a year. You've got about a 95% chance that you'll be able to cure the cancer, regardless of what stage it's at.
Let's speak about some of the key risk factors which are associated with prostate cancer, Prof. And are there specific groups or demographics that should be particularly vigilant?
Oh, yeah. I think that's such an important thing. The demographics are very important because remember that we know that black Africans in general have about a 3 times to 5 times increased risk of getting prostate cancer, and also the same similar increase in dying from prostate cancer. So our population in general in South Africa is a high-risk population. So we need to get addressed, and it's not just blacks, though it's also Caucasians and Asians. We all need to get ourselves checked. And there are a couple of things that we can help to prevent prostate cancer. And I always like to say that it's the big 5 in Africa. It's the standard of care for almost every type of problem that we have for health in men and in women, which is really exercise, diet, not smoking. Stress it can cause cancers itself. And of course, no excesses of things such as alcohol and that sort of stuff. But there are some interesting ones which can also protect you. For example, we know that there's some chemicals in, particularly in cooked tomatoes and in melons, called lycopenes, which do have a bit of a benefit. Also, the more sex a guy has, getting rid of the ejaculate also decreases the risk of prostate cancer. But I think really just taking a general control of your health, and as guys, we are really not very good at taking care of our health. Just get yourself checked out about once a year, particularly from the age of 40.
But then it also begs the question that what are some of the symptoms of prostate cancer? And if I suspect that I do have them, what do I do?
Yeah, another great question, because the point is that, to put it simply, the prostate has 2 main problems as we get past 40. One is the normal enlargement, which we call BPH, which happens to every man, called benign prostatic hyperplasia, which grows in the middle of the prostate around the pipe for passing urine, which then can cause difficulty passing urine and such things like that. But prostate cancers, unfortunately, develop on the outside part of the prostate. So there are actually essentially no symptoms until the cancer is spread. And that's why we really need to just control our health as guys. Go out, make sure that we get ourselves checked, because this blood test is a pretty simple thing. It gives a great indication if there's a possibility of cancer, because once you get symptoms which often happen when it gets late, like back pain, because the prostate cancers love going to bone, and especially the spine. They get loss of weight, you get loss of appetite. That means the cancer is spread. And so we really need to start getting ourselves checked out early. Just get the blood test taken, and we'll see from there.
Could you share some of your insights on the importance of getting regular health checkups for men, given this tendency for men to underutilize preventative healthcare services compared to women here?
Oh, yeah. Women are far more clever when it comes to their health in general. I mean, they see their treating physicians and healthcare providers 5 times more than men in their lives. And that's one of the main reasons why they have a longevity. They live at least 6 years more than men, longer than men. And we also take more risks as guys. We're less likely to get ourselves checked. We're more likely to think stress and that sort of thing, which we know is actually releasing things into your bloodstream which are causing you to get cancers, heart attacks, strokes, loss of limb. We need to start taking our health more seriously. And I really would encourage guys to just at least go and see their physicians or healthcare providers at least once a year.
I want to expand our conversation and speak about the role of organizations and communities in promoting awareness to also encourage men to really prioritize their health, especially regarding prostate cancer. Give us your thoughts on this aspect.
Oh, yeah. First of all, I'd like to just commend that all the health departments in the country, Department of Health, all the medical aid schemes, all of them have got programs which are helping to try to pick up prostate cancer. We know that it's the second leading cause of death from cancers as well in South Africa for South African men after lung cancer, which again is caused by smoking, which is one of the lifestyle issues which really need to be addressed. But we've got a lot of other organizations, and fortunately I've been part of as a founder of the Prostate Cancer Foundation in South Africa. We've been at one of the forefronts with CANSA, which is also involved with a lot of cancer promotions and things, but even the healthcare departments and that sort of thing. And what's really lovely is besides it's a multifaceted thing. It's not just the government. It's not just the private sector. Many organizations are involved, and I'd really like to just encourage all guys to remember that on the 13th of October, we are having our Hollard Daredevil Run. Hollard has been a stalwart as a company to actually assist the Prostate Cancer Foundation and CANSA in maintaining our ability to actually give information to people. And it's really it's heartwarming to see that everybody's actually been involved, and we actually have data to show that we've actually improved the outcomes for our patients by these collaborations between things. And remember, on the 13th of October, we're going to be running in our purple Speedos, nothing else. Please, guys, please join us for this festivity.
I want you to expand a bit on a point that you touched on a bit earlier about the various treatments for prostate cancer. How do they differ based on the stages and also the aggressiveness of the cancer?
Oh, yeah. The first thing is that we must remember that the majority, about 50% of prostate cancers are going to be Mickey Mouse cancers, which are not going to give you any problems. I mean, like I'm in the age group where I should be checking. And if I was to pick up a cancer in myself today, a prostate cancer, it probably wouldn't give me any problems for maybe 10 years. But the point is that hopefully I'll live till 10 years. And we don't want to get to the point 10 years later where you actually have a problem. That's why we want to screen. And if we do pick it up early, these 50% that have Mickey Mouse and not doing anything serious, we often just watch them. We don't do anything. Because the biggest problem with any of our treatments for prostate cancer is that the prostate is right next door to the penis, which is also related to, and right next door to the bladder. And we know that if you have any sort of aggressive treatments to the prostate, it can impact on your sexual function. It can also impact on your urinary function. But if we pick it up early, often we don't even have to do these treatments. But even if we do have to do the treatments, it's not like everyone has a problem. And you've got about a 95% chance that you'll be able to cure the cancer if we pick it up early. And just to give the fear to the guys out there, we pick it up late, the stage 4 that people like to talk about, where it's spread, the mainstay, the backbone of treatment is actually to remove your testicles, get rid of the man chemical testosterone. And we've got so many side effects from that, not only sexual, we get bone loss, we get muscle loss, increased fat. All of these things, you don't want to be getting into that stage if you can avoid it. So the main thing is for you to make sure that you do get yourself checked up so we can cure you early and you'll have minimal side effects.
But is active surveillance another suitable option for myself when I consider getting screened for prostate cancer?
Oh, definitely. It just depends on a number of different factors, but the essential thing is that we've got like 5 different grades of prostate cancer. If you're grade 1 or grade 2, and you've got relatively low blood PSA, the blood test I was talking about called the PSA or prostate-specific antigen, which is the one we do about once a year, and it doesn't look like it's nasty on some of the x-rays, the majority, 60-70% of people will never need any active treatment. We do need to still follow you up and see what's going on. But the reality is that you can live a perfectly reasonable life. And I really think it's important for us to remember that if the quality of life is the most important aspect that we're looking for when it comes to any sort of treatments as medicine now, because that is the backbone for us as a population as well.
And going back to the issue of treatment, Professor Mutambirwa, are there any advancements being made in the field of really treating prostate cancer?
Oh, lovely. Yeah, we're actually involved in a lot of these things as well because we've been involved with the genetics and the targeted therapies which are out there. And I really must give a thumbs up to all of you because as prostate cancer fraternity, we've actually come up with a multidisciplinary team where everyone's involved, not only urologists, not only cancer doctors, oncologists, not just a radiologist looking at x-rays, not just pathologists looking at, but people such as nuclear medicine, where we can actually have targets where we can actually use radioisotopes to actually kill the cancer. Trials are ongoing. There are lots of other things where we're using our own immune system to actually kill the cancers. Lots of treatments that are out there, from what we call the androgen receptor targeting agents. These are things like enzalutamide, abiraterone, and darolutamide, which actually go into the cancer cell and kill them. There's so many progressive things that are going on, but I think the more important thing really is that we need to pick it up early, because even those treatments do have side effects as well, and they can be quite costly.
So as we wrap up our conversation, Professor Mutambirwa, beyond just getting treatment, are there any support groups or other resources that individuals or families can utilize in also seeking help regarding prostate cancer?
I think that there are many resources out there. Remember that a lot of them on the internet do give you good information, but they may not be targeted directly at us. So I think the important thing for us is to try to focus on the sub-Saharan African group and South Africa particularly, and that would be including our Department of Health. Almost all the medical schemes have a great resource as far as cancer assessments, not only prostate cancer, because we mean colon cancer, lung cancer, they're also big things. But also the Prostate Cancer Foundation is a big resource. Cancer is a big resource. And Hollard and the rest of the teams that we are involved with are also there. And also yourself, and I'd like to thank you for the opportunity, because you're actually helping us to spread the word and help guys to save themselves from prostate cancer death.
Professor Shingai Mutambirwa, of course, speaking to us, September is Prostate Cancer Awareness Month. The professor explaining why early detection of prostate cancer is crucial and how it impacts the odds of survival as well.